So when you say cardiovascular disease, what do you mean by that?
So it's heart and blood vessel related disorders.
Okay.
It may be an heart attack, which everybody is aware of,
So
and
heart attack is a kind of cardiovascular disease.
kind of cardiovascular disease, or one of the most common cardiovascular disease, where a heart attack means there are three blood vessels in the heart, that is coronary arteries. It may get blocked. Okay, so that is called heart attack.
So there are three major blood vessels supplying the heart.
So
And out of that, one is the biggest.
yes. No, three major vessels. One we give more importance because it's most commonly blocked. That is
And
the
what
left
is
side.
that left?
LAD, what do you say? Left anterior descending coronary artery. Like if our body is a vehicle, heart is an engine. So that engine needs some fuel supply, just like we put petrol in diesel. That is what is carried by the coronary arteries to the heart, so that it can pump efficiently, and then the blood will go to all parts of the body, including brain and other vessels. So when there is a supply-demand mismatch, that is when blockage is there in the coronary artery. So when heart is beating more, that is when we exert, we do some activity, our demand is more. The demand for the heart is more blood supply, and the supply is less. So because of the blockage, so supply-demand mismatch happens. That's why they develop ischemia, low blood flow, myocardial damage, pain. All those things manifest.
So the blood vessel is a pipe through which the blood flows into the heart muscles. And then there is a plaque that forms in the blood vessels. And it is mostly a cholesterol plaque.
Yeah, cholesterol deposition. So it's a gradual cholesterol deposition that may start depositing once we start taking artificial foods. Maybe even by 10 years child also we see that nowadays it's cholesterol deposition. That gradually it increases, and it doesn't produce symptoms until one day it produces chest pain or manifests as a heart attack.
So slowly the blockage gets accumulated.
Yeah. So only the blockage gets accumulated, and then one fine day, because of some stress, because of exertion, and then there's a rupture of the plaque. The blockage. No? There is a small, just like when we have a wound, cut wound. So suddenly blood clots in the remaining part of the lumen, occludes it. So there will be an underlying blockage, and superadded to that, clotting of blood happens. So there's a sudden cut off of blood supply to the heart. So 100% cut off of blood supply. That's what is called as heart attack.
So patient will have chest pain only when there is 100%?
No. So when blockage is more than 70%, they may develop ischemia. So on walking and exertion, they develop pain, manifesting symptoms. So pain, anginal pain, what we say, the pain on exertion. Relieved at rest, or on taking nitrates medications. So that anginal pain, which is very typical of coronary artery blockage, can get manifested when there is more than 70% blockage in any of the major blood vessels.
In the main blood. So there are three blood vessels. If it is more than 70%, what happens is when you exert or when you climb stairs or when you walk, you will get chest pain.
Yes.
And then when you take rest, it will get better.
Yes.
It's a very classic sign.
Yeah. And there is one main blood vessel. It's called powerhouse of the heart. That is left main coronary artery, where which is going to supply almost 2/3 of the heart blood area. Blood supply. So if it is blocked more than 50%, even then it can produce symptoms.
Oh, I see.
Yeah.
Okay. And all the risk factors you're talking about, genetics, smoking, obesity, all this we are talking about the buildup of the plaque, with cholesterol plaque within the blood vessels.
Yes.
And smoking increases the risk of plaque is what we are talking about.
Definitely. Smoking increases. Not only smoking. We said in India, it's because of stress, psychosocial stress, either because of work-related stress, you have to reach the target, or family stress, social deprivation, emotional stress, all those things, and lack of sleep.
So what happens in stress, sir? Why stress increases the cholesterol plaque?
Yeah, so during stress, always stress hormones get released.
Like cortisol.
Like cortisol gets released, and automatically your heart rate, blood pressure is going to get altered.
Heart rate and blood pressure goes up.
Yeah, goes up. So the blood flow in the coronary arteries can also get altered. So usually it is a laminar blood flow, what we say, and it may become turbulent.
What is laminar blood flow?
Smooth blood flow. Yeah, that's what I should say. The smooth blood flow can become turbulent, especially at the branching points of blood vessels, where blockages commonly happen. So stress definitely is going to alter blood supply, blood flow pattern, and going to lead to blockage.
So what is the youngest age that you might have seen a heart attack?
See, a heart attack I have seen maybe at 21 years of age.
21?
College going student. He had a risk factors. He had a family history of cardiovascular disease, and like both parents were diabetic also, and so he also had a diabetes at a younger age, and he was obese, and other risk factors were there. Physical inactivity also was very common with him, and maybe because of that he dealt that. So youngest was 21 years of age.
What happened? He came in with chest pain?
Yeah, he came with the heart attack, And then luckily we could resuscitate him and revive him. So I had put
What
a
do you mean
stent for them.
resuscitate him? He was
He came with
unresponsive?
unresponsiveness,
Are
collapse
you
to the heart.
serious?
Yeah.
Oh my God.
So it all depends on the area where the segment which is affected, the territory of blood supply which is affected. So some people may have blockage almost in the distal part of the blood supply. That is the end of the vessel. They may even come driving also with the chest pain. If it is in the beginning of the blood vessel, more areas affected. It's like whether a water supply is affected to one floor or the entire building. So it all depends on like that.
Wow.
So
So he came unresponsive.
and
Family members brought him.
family members brought him.
And then you found out that he had a heart attack.
Family members and friends brought him, and then immediately we had initiated our emergency protocol. What we say, STEMI protocol, and then ECG was done, echo was done, then angiography. We found the blockage, discussed the family, and stenting was done. So blood flow was returned.
You're doing a wonderful job. I'm just trying to explain to the layman in
Yes.
terms of what you're saying.
Yeah.
Okay, so I'm just going to summarize what you said. Patient came with heart attack, unresponsive, and then you've noted that there was a block in the heart. So you went and did an angiography, which
Yeah.
is a small catheter that goes through the
No, so blood vessel. It may be in the wrist
maybe
or
your
in the
wrist
groin.
or in the
Yeah,
groin.
So this catheter is like a tube which is passed under fluoroscopy. That is X-ray kind of thing.
Goes inside the heart.
Inside up to it reaches
And
up to
then
the heart.
looks into the 3 blood vessels.
Yeah, 3 blood vessels. We inject a contrast dye, and then we can see whether any blockage is there, percentage of blockage, number of blockages, and where is it located. And then
And
we
this
decide
patient
for,
had a complete blockage.
yeah, he had a complete blockage on another important vessel, major vessel,
The left
LAD.
one,
Yeah,
LAD.
left one.
And then you put a small plastic stent.
No, the metal. It's a
Metal.
metal. So it's called a drug coated stent, but we had put. And then immediately blood flow was returned, and then he gradually improved.
Can you educate the audience what is a stent?
So a stent is a ultra thin metal. Okay. So that is what you say, drug coated stent. It has a drug which is also coated over that, and then usually it is crimped. It's like a simple term we can say it's like a spring kind of thing. So it's all crimped. It's very small. Then we pass it over a catheter, and then once we go to the target place where the blockage is there, then it is mounted over a balloon catheter. So when the balloon is inflated, so the stent expands, the metal expands. And after that, it stays in that position. Then we deflate that balloon, then bring it out.
Which means the clot is broken open.
Yeah, clot is broken open.
Broken open. So that the blood supply can come back again.
Yeah, blood supply can
And the
come back.
timing is very critical, right?
Yes. So here, time is myocardium. But
Time is your heart muscle.
Time is heart muscle. So, and for heart problems, then people have to reach hospital immediately. Nowadays, ECG is available everywhere. They can take an electrocardiogram where they place multiple wires, and then heart attack is found out. And I would say that always people have to go to a nearby hospital which will have an ICU facility, because once they have chest pain, then even if an ECG is taken, they should be managed for further treatment. So an ICU setup should be there. So better to go to a hospital which will have this kind of facility. So always when chest pain is there, go to a nearby hospital. They may take an ECG. And if most of the time heart attack we diagnose in that only. If some doubt is there, then echocardiogram, scan of the heart is done. Then we'll also go for blood test, troponin. That blood test is done. So mostly we'll be able to diagnose heart attack with this.
With this. So let's say that somebody is diabetic. Okay. And then we just talked about the diabetes increase the risk of heart attack. A family member is watching him and he had chest pain. Okay. He's saying, Appa, I have chest pain. What should they do? The first step.
When somebody has a chest pain, then they will go to a nearby hospital. Preferably to an hospital which will have an ICU facility. Immediately an ECG will be done. Usually it is advised to take an ECG within 10 minutes of arrival of the patient to the hospital. Mostly we'll be able to diagnose heart problem with the ECG. Then additional echocardiogram, that is a scan of the heart, or a blood test, troponin level will be done. And once we diagnose heart attack, the first aid medications like blood thinner medications will be given. So usually it is advisable to give 2 blood thinners. It's called loading dose. We give medications, and also a cholesterol medicine, statin also will be given. So 3 medicine that is considered to be the first aid medicine for a patient with heart attack in any emergency. And if that hospital is going to have an facility, ICU facility, and they are able to have, if they are having a cath lab where they can do an angiogram, an angioplasty, then you can continue with that hospital and then do the procedures. If that
If not, you
hospital,
get transferred.
yeah, and this blood vessel, then otherwise they have to get transferred to an hospital which will have this facility.